Okay, so let's talk about the circulation of the arms. This isn't bad at all, but we are going to talk about veins, and we'll do that in a moment. But the arteries, a piece of cake. All right, I'll show you. That's it. That's the blood vessels of the arm, or at least the arteries. Let me show you now. And I'll show you where these divisions are. The subclavian artery becomes the axillary artery. Okay? Be careful of spelling that. Some people put auxiliary artery. It's not. It's axillary, like an axe. Then that turns into the brachial artery, and that splits into two. On the thumb side, that becomes the radial artery. On the pinky side, that becomes the ulnar artery. All right? Then there's also going to be minor things, but we have arches. We have a superficial arch and a deep arch. And then from there, you're going to have the digital arteries going this way into the digits. All right, those aren't very nerve-wracking on there. Okay? And then there's something over here which I'll explain in a moment. So that's basically it. So remember how I said you're driving a road, you're on the same road, it just changes its name. Subclavian becomes the axillary, becomes the brachial, splits into two, radial and ulnar, and then it goes into the palm. So you have these superficial and deep palmar arches that go to the digital. That's it. It's a piece of cake. Okay? Now, where are these divisions, though? Okay? So this is very busy. I wouldn't recommend doing this just yet until you really know your arm. We can go back to this. But this is what's happening. The subclavian becomes the axillary when you get to the first rib. That's our landmark. That's the McDonald's. Okay? Then it stays as the axillary until it reaches the teres major muscle. And now it's known as the brachial artery. Okay? That's our landmarks. Now, these Spider-Man and the models here really aren't showing a teres major muscle, so how are you going to be able to tell? I'll show you. Here's a subclavian. See, there's other blood vessels that come off of this. You don't have to worry about them. Well, what you do is which is the vertebra, which we did before, and we're going to talk about this one in a moment. These you don't have to. But look, subclavian reaches the first rib, and now it's known as the axillary artery. Then it looks like this guy's falling. Ah, I'm falling, right? So he wraps his arm around the humerus. He said, look, I'm falling. You don't have to worry about this one over here, but he wraps his arm around here. This is what we call the posterior circumflex, and anastomosis with the anterior circumflex arteries. So that's over here. One going that way, and one going that way. So it's the anterior, posterior circumflex arteries. So if you see it on like the Spider-Man over here, you see that I'm labeling where the circumflexes are. You know you're on the axillary artery because it's coming off of that. That's how you can be able to tell. Anything distal to that is really going to be the brachial artery. So you're not going to see the muscle here. Does that make sense? There's some of the flat models that you're seeing on some of the desks over here. You'll be able to see the ribs. So that's actually pretty easy for you to actually figure out where the subclavian becomes the axillary. Okay? questions on that, but that is the arteries of the arm. Okay? So here he is, he's wrapped around here. Oh, man, I'm falling, right? And it comes down, here's your brachial, and it splits into two. The radial and the ulna. And then it goes into the palm. You can see the deep and the superficial arches, and then they go into the digits itself. All right? The palm isn't so bad. All right, now, veins. Okay, it's not bad. But let me start drawing my picture over here. So this is where I would normally put some music happening. Okay, but I'll show you. But I always think it's important that you watch me draw this so that you understand that you can draw it yourself. Okay? It's like watching those artists paint landscapes and stuff. Not that I'm comparing myself with that, but this. Yeah, that's what I mean. Draw a happy tree over here. Yeah. All right. Now, let's see this goes. And these little green things are just imaginary kind of divisions. To help you along with where blood vessels are going to meet up with things. Okay. All right, now, what I'm going to do is I'm going to label it the opposite of the way the blood flow is. Because I kind of conditioned you seeing how it goes this way. In other words, blood flow is going this way. Right? For arteries. Blood flow is going this way in veins. Does that make sense? Okay? But I'm going to label it for veins. I'm labeling it this way. So don't get mixed up. It's just easier because you're familiar with that. I just want to label it the same way. But they are going the opposite ways. All right. This you should know. What blood vessel is this? Yeah, inferior vena cava. Again, I'm abbreviating. You wouldn't abbreviate on your exams and trace questions. I'm just doing it so it's not so busy. All right, and this too is going to be your inferior vena cava. So it's passing through the diaphragm. So what do you think this is? Superior vena cava. The inferior vena cava is very long. The superior vena cava is very short. Then we have this. We have this branch and this branch. This is the right and left brachiocephalic veins. Now, common mistakes. How many brachiocephalic arteries do we have? One. How many brachiocephalic veins do we have? Two. Okay? I've had people call this the right brachiocephalic artery. Now I'm confused on what you're saying. Are you saying one, if there's a right, there's going to be a left brachiocephalic artery? Or are you really meaning this is the right brachiocephalic vein? Do you see where I'm getting confused? And it's not that I'm hard, I just don't know if you know what you're talking about. Does that make sense? This is just the brachiocephalic artery, whereas this is the right and left brachiocephalic veins. I normally wouldn't make a big thing about right and left. If you wanted to call this the right, or let's say the left brachial artery, I'm not going to make a big thing because it's coming from the same place even though it's on there. I'm not going to make a big thing. In the chest, it makes a whole big difference. You want to call this the left common carotid artery? No, because where does the left common carotid artery come from? The aortic arch. Where does the right common carotid artery come from? From the brachiocephalic artery. Completely different. So in the chest and the neck, it makes a whole lot of difference. My suggestion is to you, just put down artery and vein, right and left for everything. So you get into the habit of writing that all down and you don't miss out on a part where it might make a difference. Okay? And again, you could use R for right, L for left, A for artery, V for vein. That's totally fine. Okay? Okay, so here's the brachiocephalic veins. That's going to turn into the right subclavian vein. So from this green dotted line to that green dotted line. Okay? Then that's going to change into the right axillary vein. And then you got the right brachial vein. On the left side, or the thumb side, that's going to be the radial vein. And on this side, it's going to be the ulnar vein. So for the most part, if you know the arteries, you know the veins. They're very, very similar. Okay? And then you got the arches here and the digits, and they're the same thing. Now, as I told you before, we have more veins than we do arteries, because the blood, 65% of the blood in your body is going to sit in veins because of the low blood pressure there. So we're going to have to build more veins. Now these veins over here are what we call deep veins. All our arteries are deep, which makes sense. You cut an artery, it's going to shoot out with all that blood pressure. You cut a vein, it trickles down. So our arteries are found deep, away from areas that you would have trauma. You don't want your artery very superficial. You're going to shoot out blood if God forbid you get in an accident or something. So you want your arteries deep in the muscles. Does that make sense? Okay? So we have a set of veins that is found riding alongside the arteries, which makes sense. There's the names. That's why we call them the deep arteries, because they follow the deep veins, because it follows the arteries. That makes sense? All right, now, we also have superficial veins, veins that are much closer to the surface of the skin. Those are the ones that you can see. Those are the ones that you're going to pierce with great passion to get the venous blood. All right, you're not going to go into the deep ones because they're too damn close to the arteries. If you miss and go into the artery instead, you got a big issue you got to deal with. Now you have blood that's shooting out. All right? Doctors, nurse practitioners are the only ones that can do that. But phlebotomists and nurses, they won't go down in the deep areas because you got to know what to do if you go into the artery. Okay? So you're safe with the superficial veins. Does that make sense? Okay. Now, we have a couple superficial veins. And I'm going to represent it by a curly Q instead of straight lines. We have one that goes from the lateral wrist, and it kind of goes up here and connects to the axillary artery, or axillary vein. We have another one from the ulnar wrist area, so the medial, and that comes up like this, and it connects into the brachial vein. This lateral one is called the cephalic vein. The one that's medial, that's next to the body, is the basilic. Okay? Do be aware that there's also another artery called the basilar artery. Where is that? Yeah, it's a circle Wills area. Just make sure you don't make that mistake because they're very close in spelling. And I do get a handful of people doing that. These are your superficial ones. We have one more superficial, and it connects the two. It kind of goes this way and goes across to there. And that's called the median cubital vein. I know it looks busy. And that is the blood supply of the arm. So, what they're trying to show you in this picture, they're showing you two arms. It doesn't have two, it's on an octopus. But this is the deep veins they're showing you, but then they're showing you what the superficial veins are like. So you got to think they're overlapping. This is a better picture. The light blue is the deep veins, but here's the darker blue showing you the superficial veins. Okay? Now, let me just show you. I don't want you to really practice doing trace questions, but let me just show you blood flow to give you an idea of what's happening here. Okay? Don't worry about trace questions just yet. Don't give directions if you don't even know if you don't know the names of the roads. Okay? Let me just show you something here before I talk about that. If I live here in the heart, and I want to go to a party that's over here. Now this is what I mean by people who know how to give directions are not going to struggle as much as people who don't know how to give directions. Let me show you. Here's where I am. This is where the keg party is. Okay? My buddy gives me directions because I don't know how to get to his house. So he tells me it's easy. Just take the ascending aorta to the aortic arch. You'll take the first left over there. That'll be the right subclavian. Take it straight there. 20 minutes. You'll get to my house. No problem. Take the ascending aorta to aortic arch. Looking for the right subclavian. I'm going down here. 3 hours later, my buddy calls me. Hey, what's happening? We're almost done with the keg. I don't know. I'm down here in the kidney. The kidney? What do you mean down there? And what do you hear all the time? I gave you perfect directions. Well, I don't know. You told me to take the first left off the aortic arch, and that's a subclavian, but it's something called a brachiocephalic. Oh, well, it's a brachiocephalic for a short time. Then it changes its name to the, it branches off and becomes a right subclavian. Well, how am I supposed to know that? Do you see what I mean? You got to know every artery going there. You skip that. I'm not going to make the whole thing wrong, but you're going to lose points if you skip the brachiocephalic. Does that make sense? Okay? Now, let me just show you, again, I don't want you to get too worried about the trace. That'll fall into place. We're going to do a couple trace questions after, like, 2 more semesters, like next Thursday, whichever. We'll go through all, I'll give you some examples. Semesters, I'm sorry, sessions. But let me show you what I mean by this. Let's say I want to go from the thumb to the heart. All right, we'll go further than the heart, but let's just say to the heart. Look what's going on here. You can take 2 different routes. You can take 3 different routes. It doesn't matter to me. Just get me there. Look, we want to go from the thumb to the heart. So look, I could take, I don't want to put numbers on it because people want to take pictures, but I could take the cephalic vein to the axillary vein to the subclavian vein to the brachiocephalic to the superior vena cava. Bam, you're right in the right atrium. That's an easy way to do it. You see how I did that? Cephalic vein to the axillary vein to the subclavian to the brachiocephalic vein to the superior vena cava. See, it's not hard. You're looking at all of this, and you only said like 4 or 5 things. That's right. You know, think of a map of the United States. I just want to go from here to Florida. You just take that straight down. What was that, 91 or 95? But you're looking at all the other roads, and that's what's scaring people about reading maps. You just have to look at the one road. Here's another way. First way, like I said, you can take the cephalic to the axillary to the subclavian vein to the brachiocephalic to the superior vena cava. Or you can take the radial vein. Take the radial vein to the brachial vein to the axillary vein to the subclavian to the brachiocephalic to the superior vena cava. That's fine too. Say that one more time. The radial vein to the brachial vein to the axillary vein to the subclavian vein, brachiocephalic, superior vena cava to the right atrium. You can do that too. Here's another way. This is the back roads. I had a few people try and do this, but it's fine. You can take the cephalic vein to the median cubital, all right, to the basilic vein, to the brachial vein, axillary vein, subclavian, brachiocephalic, superior vena cava. Let me show you that again. It's busy. It's the back roads. Okay? You take the cephalic vein to the median cubital vein to the basilic vein, this little piece here, to the brachial vein, to the axillary vein, subclavian, brachiocephalic, superior vena cava. You don't have to worry about all those ways. Just get me there. That's all I care about. One way. There's 3 ways you could do that. So it looks busy, but don't make it busy. Don't worry about the trace. I'm only showing you that should, towards the, if you're going to do this, let's say, if you feel very comfortable with knowing the names of the roads, then just try one out if you want. But don't worry about it now. Just know the names of the roads first before you can give directions. Okay? Questions about that? All right? So, you nurse wannabes, you're going to need to know the antecubital fossa better than anybody. All right? So you're going to need to know what's going on. You're usually going into the cephalic vein, the median cubital, or the basilic. Those are your superficial. There's a lot of other branches, accessory branches coming off of that you could hit too, but those are the main ones that you can hit. And you'll need to know that like the back of your hand. And not only that, but you'll need to know all about what muscles are around there. You'll need to know what nerves are around there, because if you're going to always be, you're the guru of venipunctures. So you need to know all the structures surrounding it. Should you break a blood vessel and it goes someplace, you should know what, if they say ow and you hit a nerve, you should know what's around that area. Okay? 2 minutes on this and then I'm done. Circulation to the thorax. The one that you need to know is something called the internal thoracic artery, also known as the internal mammillary artery. That's what you need to know, and that's it. This other stuff is just fluff. All it's saying that it's the first branch coming off the subclavian artery. There is a branch that comes off the subclavian, but it goes up. That's the vertebral. But we also have another one that goes down, and that's this one, internal thoracic. And it kind of goes this way. It really goes berserk, because it goes down here and does all this changing of names and stuff, and finally goes into your groin. But we're just worried about it in the chest, okay? What it is here's the subclavian up here, right? This is your aortic arch. So there's the brachiocephalic. There's the subclavian. It goes down like this, and there's branches that go out to the ribs. This is your internal thoracic. If you see it here, it's this here. Why is this one important that I want you to know? Because when they do heart bypass surgery, they could use 3 different things. And heart bypass surgery is simply, if this is a blood vessel that's going to your heart, right? A branch of your coronary artery. If there is a blood clot over here, which means you're not getting to the heart, we're just going to make a bypass. We're going to take a piece of your vein from your leg or some synthetic thing, or we could take this and we're going to put a hole here and a hole here, and we're going to do this. A bypass. Now the blood can go this way and bypass that clot. That's what a bypass is. If you do 5 of them, then it's a quintuplet bypass. All right? But where they get in this could be a vein from your leg, which we'll talk about later, the lung saphenous. All right? Or they could use a synthetic tube, right, that could bend and stuff. Or what they can do, since this is carrying oxygenated blood, we're just going to snip it here and snip it here, cut it here, and then use that as a bypass. So the blood goes this way, and it goes right into where the heart muscle is. It doesn't worry about slipping here and here. There's anastomoses. There's other ways that blood can get to those ribs, so we're not worried about that. So they might take the internal mammillary artery to do that bypass surgery. You should know that one, okay? Now, that's what gives blood supply to the chest, at least, in that area there. The veins, I'm not going to ask you anything about the veins in the chest. The only thing I want you to be familiar with, because if you get really busy, I want you to know the azygous system. If I said to you the word azygous, you should think, well, that's the venous system that's going to drain the chest. It's deoxygenated blood that's going to come from the chest and put it back into the superior vena cava. So azygous, you don't have to identify it, you should just know that the word azygous is really dealing with deoxygenated blood from the chest going back to the heart. Okay?